Greetings to everyone out there in Team Whip land. I hope everyone is having an awesome day thus far. I bring you greetings from Team Whip, which stands for Working to Help Those in Pink. We have a special guest on today, and this is Mr. Brent Fuller of Lowe's Pharmacy in Lafayette, Alabama. We are going to be talking about me and my meds, managing menopause. Let our guest introduce himself.
Well, thank you. It's great to be here. I appreciate the work you do and the organization that you represent. It's actually close to my heart. My mother has had breast cancer, so I admire you all because you're all extremely courageous. And that's that you should be commended for that.
Well, thank you.
Well, like you said, my name is Brent Fuller. I've been a pharmacist for 25 years. I work at Lowe's Pharmacy in Lafayette. I am married with 2 children. I have twin daughters.
Oh, wow.
And I am an active member of my church, Lafayette Heights Baptist Church. And in my spare time, what little I have, I enjoy working in my garden and in my yard.
Wow.
So
I love gardening too. My husband has a garden.
Yeah.
He doesn't let me in it, but
okay.
I stand from afar and watch.
Well, that's good. Well, my wife doesn't go near mine. So.
I heard you say your mother had breast cancer.
Right.
So this is something that's dear and near to you.
Absolutely.
Okay. And we talked about earlier, we want to talk about managing menopause. What do you have to share with us on today?
Well, first, I need to give a disclaimer. The following information is for educational purposes only and does not substitute for professional medical advice and consultations with your healthcare provider. So, that being said, you may say, what is menopause? I'm sure that's something you've heard all of your life, and you've heard people who are going through menopause, but what exactly does that mean? Mm-hmm. Well, it's a normal change in a woman's life. It's something that, happens to everyone if you live that long. The actual definition for menopause is not having a period for 12 months in a row. So, and that occurs from the ages, most commonly between the ages 45 to 55.
And that's what I was going to ask you. Is there a definite age when you will begin menopause?
Well, that varies. Some people younger than others. Some, are outside of that range. Mm-hmm. So it really depends on a lot of factors. Your family history, different things. But what happens is, and what brings menopause on, is when your ovaries no longer produce 2 hormones, the estrogen and progesterone. So those are the hormones in the female body that it just stops producing those, and therefore, once you meet the criteria for the 12 months, no period, then you're considered in menopause.
Okay, so when you say period, you're talking about menstrual cycle.
Right.
Okay.
Right.
Okay.
Absolutely. I'm sure you all have heard of a lot of symptoms associated with menopause, but I was really wanting to go over with some of those and just discuss those. Now, that doesn't necessarily mean that everyone experiences these symptoms. But some are physical, some are sort of psychological symptoms. Anxiety is a common one. People, you just get anxious and, short-tempered. That can be a symptom.
What we call an attitude.
Absolutely. Absolutely. And husbands don't even bring that up. So.
They're not.
Another thing is hair loss or hair thinning.
Okay.
Which is common. That's a common thing. A lot of women in that age, they have difficulty sleeping. A lot of them will have night sweats. Yeah.
I'm having one now. So, and let me ask you this, and I know you said this is educational purposes only.
Right.
So, not just because you're hot. Is there a difference that you can tell between a night sweat and just because the temperature in the home is great?
Well, what happens, your body actually increases a very small amount of temperature, and even though it's just a very small amount, it just really it makes you extremely uncomfortable. It just makes you have the flushing feeling in your face, just like you can't get cool enough. A lot of, some women will go to their freezer and stick their head in the freezer just to find relief from that, because it is so uncomfortable.
Now, being a breast cancer survivor, I have it coming from my feet. I can tell it comes from my feet, and it slowly comes up my body.
Works it up. Yeah.
Right, and in about 3 minutes, I may cool off.
Yeah. It's weird, and it's that, the fluctuation of hormones, just the change in that, it plays such an important role in your body. And you begin to realize it more as those hormones decrease as you reach that age. So
that comes from where our ovaries stop producing
right,
too.
Right. The estrogen and then progesterone is another one.
Okay.
And I'm going to get to a little bit more about those in a minute.
Okay.
I wanted to mention a few other changes that a lot of women experience.
Okay, help us, please help us.
Well, and you may have experienced this, changes in skin conditions. You may have more oily skin than normal, and some people are really dry. Some people have adult onset acne associated with that, right? Because just think of acne in teens, it's because of a hormonal fluctuation. The same is true for adults, women going through their hormonal fluctuation. It can cause acne. So
wow, very helpful.
Yeah, I don't know if I mentioned migraines and headaches is common.
Is it?
Very common at that time.
So if someone is having migraines and they can't explain why, it could be that they're
going
through.
It could be
that you're going through menopause.
Right. Absolutely. Heart palpitations, which is just you just sort of like you feel your heart beating really fast or more strongly, just sort of like it's fluttering. That's a symptom. Increase of facial hair.
I have to shave quite often.
Some more of the psychological things, feelings that you're just not yourself, that you're just not what you used to be. Changes in mood is so that's a big one also, along with problems concentrating, problems remembering things. Those can go along with that.
So everything he said, I'm in menopause.
Okay. And that leads me to an important change. A lot of people who are reaching menopause, they have beginnings of osteoporosis, which is the thinning of the bones, and also they are that's when your risk of heart disease increases, because estrogen, sort of acts as cardioprotective benefits for your heart.
Oh wow, I didn't know that.
So when you that gradually decreases in your body, those are things that you need to be aware of, and it's really important that you visit your doctor regularly, and he or she monitor that, because that is something to begin watching more closely.
Oh, I'm gonna make an appointment next week.
Okay. All right.
Let me ask this question before we move on. Do all women experience menopause?
Well, it varies. Some may have every symptom that we've described. Some may already be in menopause and not realize it, because there's just nothing really there that stands out to them as being out of the ordinary. Those are the lucky ones. But to a certain extent, everybody may have some changes, they just may not realize it.
Okay. Okay.
So, but I kind of wanted to get to and talk about ways to treat menopause.
Oh, help me, please.
So, okay, well, we'll
Help
do
me,
our
please.
best. The most common is what they call hormone replacement therapy,
Okay.
which is replacing, the estrogens that your body no longer produces. You can replace the progesterone. You have to do that with a synthetic hormone called progestin.
Okay.
Those come by themselves in combination, and that's definitely something that your physician would decide what would be best for your particular circumstances.
Well, let me ask this question, because we all know WHIP is a breast cancer organization. Do you have to have already had cancer in order for the doctor to prescribe a hormone therapy?
Well, some hormone therapies do target the parts in your body that may make you more susceptible to recurrence of cancer, and those are hormonal therapies, and those are kind of different than ways to treat menopause.
Okay.
Menopause, like I said, treated with estrogen, hormonal replacement therapy, estrogen and progestin, and usually it's not a good idea for patients who are cancer patients to use those type of treatments, because it can increase your chances of a recurrence, and of course that's the last thing that you want to do. So,
right.
So, there are some natural remedies that people find relief with that I will discuss here shortly.
Okay.
Like I said, the estrogen, for people who can have hormone replacement therapy, estrogens, which come in oral tablets you take by mouth. There are patches, gels, creams, and even vaginal inserts that help to replace that estrogen that's no longer there. The combination products, estrogen and progestin, those are tablets and patches.
Okay.
And just the progestin only medication, that's just oral tablets.
It's oral tablets.
So,
okay.
right.
So that's taken by mouth.
Absolutely.
Okay.
Absolutely.
Okay.
Yeah. Lots of different methods for getting it into your body, and some have advantages over others, some people like to wear a patch because you just replace it maybe like every 7 days. You don't have to worry about taking your medicine. So
should you take it on time the same day, or the same day and same time, or just any time within a 24-hour period?
It's best to maintain steady hormonal levels,
okay.
And that's true with most medications. You want to, take them on a schedule. So like if you take your meds at 7 o'clock in the morning, just try to make sure you take them at 7 o'clock. And that's fine to take hormones in the morning like that. So,
okay.
But I wanted to mention some of the problems with hormone replacement therapy. We touched on the cancers, different cancers, breast and ovarian. Those are contraindications to being treated with hormones.
Okay.
I don't know if you've heard of people who have had blood clots. Some people are more susceptible to blood clots than others, and some actually have a medical condition that makes them susceptible to blood clots. Well, those people need to avoid estrogens or any hormones like that.
So y'all hear that? If you're susceptible to blood clots, you need to avoid hormone therapy.
Right, and I, as a pharmacist, I always say check with your doctor. Under rare circumstances, they may want you to be on those, but not likely. So, like I say, every person is different. Every therapy is individualized. So that's something that you would need to, definitely discuss with your doctor.
Okay.
Patients with bleeding disorders. Not necessarily menstrual bleeding, but just bleeding disorders in general. Those patients need to be very careful about that. Patients with have a heart attack or stroke history, those, because just estrogens themselves can increase your risk for blood clots. So really you need to avoid them.
I didn't know that.
Yeah. So that and also that's why you may have heard. Young women who take estrogens for birth control, it's still estrogens. It's never a good idea to smoke. I don't advocate smoking at all, but that in combination highly increases your risk for blood clots.
Okay.
So also patients who have had liver problems, that's just not a good idea. So to take any type of hormonal replacement like that. But now that doesn't mean there's no hope for you. If you're still experiencing problems, and if you just really need help, I wanted to mention some natural remedies that people
help us.
There's one in particular. It's an herbal type thing. It's called black cohosh, and it's effective for hot flashes and night sweats. Two of the.
Now, do you have this at your pharmacy?
We do. We actually we sell a lot of that for women, who don't want to do any type of hormonal therapy for reasons we've mentioned previously. Being herbal, it's generally safe. Now that doesn't mean that it doesn't. Some herbal products do have drug interactions with regular medications, so always ask us, and we'll be glad to help you with that.
Okay.
But it's a product called black cohosh.
Black cohosh. Okay.
And that's a good one. Soy. There's just regular old soy. Look on packages, and if you see anything that says that it contains isoflavones, that's actually what the ingredient in soy that helps.
Okay.
That helps with that. Isoflavones.
Isoflavone. Okay.
Right. Those are good for the hot flashes and the night sweats.
Okay.
Flaxseed, it's just a common, herbal thing. A lot of people use it for different things, but it has a product called phytoestrogens. Sort of like I think of it as like an herbal estrogen.
Okay, phytoestrogen?
Phytoestrogens.
Phytoestrogen, okay.
Right. That is particularly helpful with hot flashes.
Okay.
If you could find that in an oil, that's a good product because the flax seed itself is hard to digest. So you don't really get as much benefit from the seeds as you would, say, the flaxseed oil.
Okay.
So that's a good would be.
Now
a good
I hope
thing
y'all
to
are
use.
writing this stuff down now.
Also, just plain old vitamin E.
Vitamin E.
Vitamin E helps with vaginal dryness. Also helps with hot flashes.
Okay, vitamin E.
And that's very safe to use. It's very readily available over the counter.
Okay.
So that would be a good one. And I will say this: it's been my experience that some patients don't find as much relief with these products as they do with, say, prescription hormonal products. But then again, there's so many contraindications to the prescription products with, like we mentioned before, the cancers, the heart attack, the stroke. So if you're ever in doubt, come to your pharmacist and use them. They have a lot of information that would be beneficial for you, and we'd be glad to help you make those decisions.
Great. Now, for those who are just tuning in, we're talking with Brent Fuller. He is a pharmacist at Lowe's Pharmacy in Lafayette, Alabama. We are talking about meds and me and managing menopause. So, for those who just tune in, you have missed it, but you can go back and play it again. So he's going to continue now.
Gotcha. All right. Getting back to the treatments for menopause, we talked about the hormonal replacement therapy, the natural remedies. One more treatment is actually exercise. As if you weren't hot enough already.
Right. Made me sweat just mention it.
And I will tell you this, exercise is more so for the psychological symptoms.
Okay.
You should aim for about 2.5 hours a week of exercise. That would be
week.
that would
Okay.
be the goal.
Okay.
Anybody can do that. Break that down per day. It's not that many minutes a day. And it also helps your entire body, not just menopause symptoms. So exercise is great. Yoga or deep breathing, if you're into yoga, that is good.
Okay.
That's helpful.
I'm adding that to my daily regimen.
Okay. Also, stretching exercises. That has been found helpful for, the symptoms. And like I said, most of the exercise, these that I've just mentioned, are for the psychological symptoms.
Okay.
But those are really good, good things to try. I mean, it never hurts to try something if you are having a lot of problems. And like I said, it helps more than just menopause. It's great for your heart health, for your weight.
Yes.
Diabetic patients, it's great to exercise. Just protect those feet. So it's beneficial.
Wow.
So.
Now I have a question.
Okay.
I seem to have, and I know I'm in menopause, I seem to have severe hot flashes when my intake of sugary products is great.
Okay.
What can you share with us about the intake of sugar?
Well, just don't eat a lot of it.
That sums it up.
Sugar. There are great sugar substitutes if you can tolerate those. Some people can't stand the taste of those.
Okay.
As you age and you lose those protective benefits from the hormones, you're more susceptible to things like we mentioned before, heart disease and diabetes.
Right.
It's real easy to become pre-diabetic. It just kind of creeps up on us onto full-blown diabetes. And if you can avoid those sugars, that's great. It's great to try to avoid those. And that doesn't necessarily mean a candy bar or a piece of cake. Sugars come in lots of hidden forms. You have to watch your carbohydrates because bread,
Yes.
your bread,
Oh,
your
my
pasta,
goodness.
all those good things. And you just have to watch those. But now in moderation, they're fine. It's just not something you want to overdo.
Oh, indulge in.
Right,
Okay.
right. Yeah, you can't stop living. And you've got to eat.
Right.
So but just do it in moderation. So.
Okay.
Like I had mentioned before, treatments are highly individualized. So, depending upon your particular situation, everyone is different. And I also wanted to stress it's important to have your yearly gynecological exams. So that is very, very important. You need to schedule that. A lot of people will schedule that around their birthday so that they will remember it every year.
Something that's significant, so you'll know.
Absolutely,
Okay.
absolutely, yes. Having your doctor checkups. I can't stress how important that is. And once you see your doctor, if they do, prescribe different meds for you, those meds are not going to help unless you take them.
Right.
So, if your doctor thought it was important enough to prescribe that for you, you need to get it filled and you need to take it, religiously. You don't need to miss doses because, what good is it going to do if you don't take it?
Right.
And I guess the last thing that I had, they call it menopause the change of life. That doesn't mean it's the end of life. You got a whole lot of living left to do.
Okay, he said the change of life is not the end of life. We still have a lot of living to do.
Absolutely, and a lot to contribute to society. So,
Yes.
Just because you've gone through this, like I said, you got a lot of living left to do.
Got a lot of living left to do. Well, Brent, we thank you for this educational session about
Thank you for inviting
meds
me.
and me, of course, with your significance relation to breast cancer. Now, today just wasn't geared for breast cancer, but it was geared towards something that occurs as an after treatment. We're talking about managing menopause. There's a lot of women out there who are not cancer survivors, who have not been diagnosed with anything. They are going through menopause, and today we just want to come in and just give you some educational points. Well, not we. Brent, he came in and gave us educational points about menopause. He is the pharmacist in Lafayette, Alabama at Lowe's Pharmacy, and he suggests any question that you have, contact your pharmacist or contact your doctor, your physician, and make sure you keep your annual appointments as well.
Right. And if you need to call me at Lowe's Pharmacy, feel free to. And if I stay busy, so if you can't get right through to me, just tell them you want to leave a message, and I'll get back to you as soon as I can. So, but this is an important topic, and my whole goal in life as a pharmacist is to help people. So. I hope that we can help someone, at least one person, with this.
Well, you've helped me. I know you have. So I'm moderating on my sugars. I'm increasing my exercise a week. And I'm going to make that appointment with my physician as well. So we thank you so very much.
Thank you.
And we want everybody to tune in. If you have any other questions, you can visit our website, www.teamwhip2015.com. There is a place there. If you have any questions for us, you can submit it via email, and we'll try to get back to you as soon as possible. Also, we want you to stay tuned, because this is the first of many educational sessions that we will have, My Meds and Me. Thank you all for tuning in, and we hope to see you next time.
Thank you.